Is feeling your emotions making your chronic pain or symptoms worse? We've known for decades that when you push down emotions, you resist and suppress feeling that anger, sadness, guilt, shame, fear, that it can escalate and worsen chronic pain and symptoms. Resisting emotions is one of the key reasons why chronic pain and symptoms is on the rise. We live in a society that suppresses emotions, that teaches us to push them down, to not feel them. And so, naturally, when you come to a mind-body approach, maybe on my channel, maybe you've started to read books by Dr. Sarno, Dr. Schubiner, we understand that we need to feel our emotions. This is how we recover. We feel our emotions, we approach them, we attend to them in the body. Now, I posted a video on resisting emotions a few weeks ago, and I got some comments being like, Tanner, I've been feeling my emotions and it's making my chronic pain or my chronic symptoms worse. So why is this? Why is it that resisting emotions triggers chronic pain, but then we start to feel them and it starts to trigger chronic pain or symptoms or escalate them? Well, the key is a concept that I talk about with my clients and in my digital course called the healing window. When we're getting exposure to finally feeling sadness, despair, anger, fear, guilt, or shame, all these messy emotions, when we're getting exposure to them, some people nosedive into it and they end up attending to things that are way too intense. There needs to be a gradual exposure to feeling emotions. And so the healing window is a window where you can tolerate attending to the unpleasant emotions, to the unpleasant sensations. It's going to be uncomfortable in the healing window, but you're going to be able to tolerate sitting with it, processing it, and moving through it. But for example, if you're attending to anger and it's outside that healing window, what's going to occur is fight, flight, freeze, shutdown energy is going to escalate quickly, and your chronic pain and symptoms are going to escalate quickly as a result. So when you're doing emotional work, and I know there's differing opinions out there, but in my opinion, when you're doing emotional work, you got to make sure you're in the healing window when you're first attending to it. You're better to start small and then work your way up. Now, over time, as you practice attending to emotions, that window can widen. So for example, fear and anger were really hard for me to attend to when I was healing my chronic pain and symptoms. Oddly enough, sadness I felt quite safe with and I could attend to quite a large amount of sadness or despair and still feel safety. But with anger and fear, it was just really hard. So I could only attend to a really mild amount of fear or anger. But over the years, that window has widened. I'm now able to attend to quite a lot of fear in my body, still be in my body, be present, and be connected. The reason you want to stay in this healing window is it helps you have one foot in safety, in that ventral vagal state, which includes safety, connection, calmness, and ease. We need to be connected and have a sense of safety as attending to emotions so that we can process them. If you're outside that window, though, there's no sense of safety and you're going to disconnect completely. You imagine someone who's in like an anger rage, throwing things around, smashing things, just freaking out. They are no longer connected to their body at that point. They're no longer in the present moment and they're not actually going to move through anger and feel safe with it. So you got to stay in the healing window. Now, the question is if you're doing emotional work, like say you're attending to fear or anxiety, and you notice that all of a sudden you're outside that healing window, you can't tolerate sitting with it. What you want to do is you want to shift to a safety signal. When I'm working with clients, I teach them if it's getting too intense during that practice, whether you're doing journaling, somatic work with the emotion, you want to shift to a safety signal. So let's review what safety signals, internal safety signals can be. Present moment sensing, one of my favorite safety signals when I'm doing emotional work. Attending to sight, sounds, taste, touch, smell. I think I got them all. Attending to your senses can help bring you back to connection internally. It can help you be connected and have a sense of safety and give your nervous system basically a moment to rest before you go back to attending to anger, sadness, or fear. You're shifting to attend to present moment senses. So everyone has different present moment senses that their nervous system prefers. Like for myself, sight doesn't work very well, to be honest. When I look around a room or a space, I tend to get more overwhelmed. But if I close my eyes and I tend to the sounds around me, allow the sounds or lack of sounds to come to my ears, or maybe it's some soothing touch like rubbing my hands together or putting a hand on my chest and making circles. Sounds and touch helps give my nervous system a sense of connection and a sense of ease and safety inside. And so then after I've attended to the sounds or the touch, then I would shift back to focusing on the emotions. Essentially, you're teaching your nervous system you can attend to emotions, and then you can shift to a safety signal that brings about a sense of ease and lightness back into your system. And a useful somatic practice that Peter Levine calls pendulating is you can pendulate back and forth. I simplify it just by saying shifting, but you can shift back and forth between something that's unpleasant and something that's pleasant. And present moment sensing can be really beneficial in doing this. Breathwork. When you're doing emotional work, it's getting too intense, you could shift to a breathing pattern that is useful and supportive for you. We're not just doing breath work to bring calmness to our system, to activate that ventral system of safety and connection. We're doing it to allow ourselves to have the space to attend to what's unpleasant inside. Now, in my digital course and with my clients, I teach a lot of different types of breathing practices. And I also want to be aware there's lots of different types of breathing practices out there, breathwork practices. They're all great. Find something that fits for you. I'll link a video up that I did quite a while ago on just 5 useful breathing patterns. So I'll link that to the top and put it down below. But finding a supportive breathing pattern that brings you back to safety and connection is a really useful safety signal to shift to. And then once you have some calmness and connection again, you can shift back to processing that emotion. Somatic movement. Movement is so essential for regulating the nervous system. Flowing movement that's slow, can help us bring a sense of safety and connection. So in a lot of my somatic practices, when people can tolerate movement, because I don't know some people can't, and that's okay. This may not be a good fit for you, but some somatic movement can be really essential in regulating the nervous system and bringing you back to safety and connection. And so I utilize it a lot when I'm working with clients and processing emotions. I have them shift to doing some somatic movement. Now, somatic movement can regulate the nervous system. It's also really beneficial in releasing emotions. It helps us attend to emotions, to explore them, to express them and release them and move through them. So movement, I have lots of practices on the channel. I recently did an anxiety somatic practice that I posted for free that has some somatic movement in it. So I'll link that to the top and down below. But somatic movement is a really essential safety signal that could be beneficial for you. Savouring pleasant sensations. Now, Alan Gordon, the creator of Pain Reprocessing Therapy, talks about leaning into pleasant sensations. Deb Dana, who does a lot of polyvagal work, she talks about savoring pleasant sensations. And so this one seems obvious, but often when we're feeling difficult emotions in the body, we get so hyper-focused on what feels unpleasant. The heart rate racing, the chest feeling tight, my arms feeling tense. We get so focused on the intense sensations that we miss all the neutral or pleasant sensations taking place inside. And so a useful practice is shifting to an area of your body that feels a little lighter. Maybe it feels floaty. Maybe it feels at ease, loose. Shifting to something that feels neutral or pleasant and exploring that area. This is a really vital way that you can work with emotions. Shifting between pleasant and unpleasant, it gives you the space to stay in that healing window. And this is a really useful safety signal that I suggest everyone try out. Safe self-talk to the body. This is really like messages of safety they talk about in pain reprocessing therapy, but safe self-talk to the body. These cognitive messages you're giving, reminding yourself that, this emotion is okay to attend to. I'm safe to explore it. These are just sensations inside. I'm human. I'm meant to feel this. And really validate it too. Like some of that safe self-talk can be validating the emotion. Based on everything I've been through in my life, it makes sense that I feel sad in this moment. Or it makes sense that I always feel angry. Validating the emotion is also a great way to create safety with it. But these cognitive messages, utilizing them as you're processing emotions can be really, really beneficial. And I would find, 3 or 4 that really land for you. Like for myself, reminding myself that, I'm human. I'm meant to feel this full spectrum of emotions. And I'm not meant to always feel happy. That feeling anger or fear just makes me human. And it's valid and I'm okay to feel it. Messaging like this really works for me, but you want to find stuff that really lands for you personally. And lastly, using your voice or music. A great safety signal that we utilize in our course. I'm very pleased that I get to work with Alex Klassen, an amazing therapist. He produces our podcast. He also produces a lot of music, amazing musician. And so we include some humming practices. We include some different types of music that can help us regulate. And so I've worked with many people that as they're processing emotions, they then shift to focus on music or to humming a certain way. It helps create a sense of safety. This is the natural way that our nervous system can regulate, is with music, is with our voice. Whether it's singing, humming, chanting, cultures have used this for centuries to regulate. And now we're just coming back to that this is a really essential way that we can create safety. So this is a fun way to play around with things. If you're really struggling with emotions, like throwing on some music that calms you in the middle of processing emotions, and then shift back to the emotions after you feel a bit safer, can be really essential. So I hope this video is helpful. I covered some of the technical points of how to process emotions. Remember the healing window, don't cheat it, stay in the healing window. And maybe all you can attend to is irritation at first, for example, but over time you can attend to more and more anger. That window widens as you breathe more safety in your nervous system. And if you're outside that healing window, use shifting and shift to a safety signal. Any of the ones I talked about could be really beneficial. So please put your questions or comments down below. Hit the like button, subscribe to my channel, and I'll talk to you all soon. Take care.